To me, that's what makes psychiatry the most interesting field, is how does the mind arise out of the brain?
I didn't realize that there are parts of the country where there are very few psychiatrists and very few options available to people who have mental disorders such as I do. And I think that's when I realized that I wanted to be an advocate for mental health awareness for people who don't have access to the resources that I do, living in Baltimore so close to Johns Hopkins.
Frankly, the experience here, I believe, was one of the most motivating forces in my life. It was difficult to come back as a sixth grader and to have been hospitalized for 6 weeks in a mental institution. There were lots of parts to the treatment, and I've been forever in debt to Johns Hopkins.
One of my favorite things to do with medical students during the clerkship is to sit with them in Meyer 3 in the back activity room, where out the window we can see the old Phipps building that's right in front of the brand new medical buildings that have recently been built. I use this as an opportunity to tell them the story of the origins of our department and how it began in 1913 with the Clifford Beers book that inspired the philanthropy that led to the Phipps Clinic. In that moment, I can show them that our department and the hospital made a commitment to the psychiatric care of patients before other departments did, and really led the way in setting a standard for excellence that continues today.
Hopkins Psychiatry is unique in its hospital being founded on the writings of an individual. Clifford Beers, who was a Yale graduate and had bipolar illness, became manic not long after he graduated, went in and out of many state and private asylums, and was treated very, very badly at that time. There was really no effective treatment.
One of the reasons that patients with psychiatric disorders were stigmatized and isolated was the fact that most of them were being cared for in farms outside of the city, and often in places that were so overcrowded that mistreatment and chaos reigned.
Clifford Beers' story made the point that these are everyday people, that mental illness is pervasive. It's part of the fabric of society. And therefore, healthcare needs to start adapting itself to the care of the mentally ill in the same way that it's adapting itself to the care of the heart patient or the diabetic.
Out of that came the construction of the Phipps building, which was designed to be bright and airy and give people the atmosphere that would help them recover from their illnesses.
It was the book, A Mind That Found Itself, that played an important role in convincing Phipps that this area of medicine was going to be important and that he should help.
Therefore, the creation of this new program, the Phipps Clinic, right next to the Johns Hopkins Hospital, making the point that the two need to be bridged because they are related.
And although Meyer was a wonderful neuroanatomist, he was also considered the first social psychiatrist. And he thought that the mission of an academic psychiatric clinic was certainly for patient care and for teaching and for research, but he thought that the clinical mission should have a shape to it. And the shape, he said, should be that you devote 50% of your resources, then meaning beds, to taking care of the community in which you live. And so that's one way to see it. And the other, he said, 50% of your resources should be devoted to what he called special cases, by which I believe he meant taking care of the toughest cases we can find in areas where we have expertise.
With the appointment of Adolph Meyer as the first director of the Department of Psychiatry, Hopkins became the center of psychiatric education in the United States and, to some extent, in the world at large. Meyer, who had already established what has become the standard psychiatric examination, began to see that people came from all over to study with him and to see what Hopkins was doing in terms of changing psychiatric care with the focus on the person. That was one of Meyer's real contributions, was to think that the level of the organism at which psychiatrists worked was the level of the person. Not the brain, but the person as someone in a setting, in a family setting, in a cultural setting. The history that he developed was tremendously detailed and structured, as was the mental status examination, something that had never really been done in that way before.
The idea that you're going to be best able to formulate a patient holistically by spending time talking to the patient, gathering history, getting collateral from other family members, doing that kind of history taking actually helps you build the narrative.
By taking such a thorough approach to the history, I think that we're conveying to patients, how much we value all the different aspects, of their lives.
Our four perspectives were simply attempts to range across the explanations of genetics and neuroscience right out to the understandings of Freud and Jung and of Meyer. And we have these four perspectives. The disease perspective that says some disorders in consciousness are simply due to the breakdown of the brain in the same way any disease in a body would. The dimensional perspective saying that it's interesting people differ in their temperaments and in their cognitive powers and in their maturity. And the behavior perspective, some people are in trouble simply because of what they're doing. And finally, the life story perspective, the story that is fundamental to the Meyerian idea is that many people are in distress because of what they've encountered and how they have dealt with it and thought about it.
When I sit down with a volunteer or a patient, I'm not talking to a brain disease, I'm talking to a person, and I'm able to understand also their life story, how their illness has affected their relationships, the context of their habits and their behaviors, all the things that I was taught as a resident to understand the patient as a whole. And that's, I think, enormously valuable because it breaks us away from thinking of psychiatry as checklists of symptoms.
I think Dr. McHugh's vision of psychiatry at Johns Hopkins as having a public education purpose, a peer education purpose, and that scholarly production of written material wasn't just writing research articles, but was teaching other people what we do. How do we care for people with dementia, and how do we help their families? I think that's something that Dr. McHugh brought here that has made us unique, and I think that it's not just me that's benefited from that approach of Dr. McHugh. I think many other individuals here have been able to take that idea and do the same thing in whatever disorder they're an expert in.
Jerome Frank taught us a very important fact. He taught us that what is important when looking at different psychotherapies is not how they are different, but what they share in common. And that what they share is the importance of the therapeutic alliance between the patient and the provider. And that is a key ingredient to successful therapy.
And he understood that we all had that capacity if we realized that the basis of this was empathy, to put ourselves in the patient's shoes, to understand to the extent we could what was going on in the patient's mind, to grapple with them through these things. And that kind of positive regard, as Jerry called it, was key to helping patients get better. It wasn't just giving a pill, it was actually having a human encounter. And I think, in my view, that's Jerry's greatest legacy.
Psychiatry is a special field. The practice of medicine really boils down to one-on-one interactions with human beings under altered circumstances, but human beings nonetheless.
One of the things that's really different, I think, about our inpatient units is how amazing our teams are. Because we have these specialty units, you'll have a team like my mood team. The social workers, the nurses, the occupational therapists, we're all doing mood all the time.
The scholarship that's offered here by our faculty, by people like Peter Rabins, Kay Jameson, Ray DiPaolo, it makes it exciting to know that these individuals who have developed in so many areas are there for us almost on a daily basis, and that we learn really shoulder to shoulder with them.
And I do really care about each and every patient that I take care of. Because I like to think that, what if this were my family member, or what if this was me? How would I like to be treated? And that just stays with me with each person that I talk to.
I do very much love what I do. I think it's important work. I think, treating these kids at a young age really can change the trajectory of their life. And so I do think it's very fulfilling and very gratifying when, you have a kid who comes in horribly depressed, is, failing, and you get them back on track, and then you find out that they get accepted to college, and, it's really wonderful.
Psychiatry has a commitment to understanding all disorders that are behaviorally based, be they substance abuse, gambling, sexual disorders, eating disorders. Those are things that are within our realm of understanding. And we look at the commonalities across those disorders in a logical, methodical way, and we research ways to try to better the outcomes for people who suffer from those disorders.
It is only in the last 15 years that I've had applicants come to me and say that they're committed to psychiatry because they want to work with the addicted, that they want to work with the underserved. And those were parts of psychiatry that were the hardest to recruit into before, and now they are the leading edge of what attracts people to them.
While we're expected to learn so much, there's room for questioning, there's room for just natural curiosities about the field that come up, and this is a place where you're allowed to engage in that and allowed to ask that questions and see where it goes.
One of the great strengths of Hopkins Psychiatry is a place, maybe the preeminent place in the country, where the tradition of the clinician scientist lives and thrives.
I don't think there's any place where the clinicians and the scientists are either working very closely together or are the very same people.
Some of the disorders that were complete mysteries to us 30 and 35 years ago, we now have a very good understanding for what the genetic defect is, what protein defect that gene defect produces, and how that protein leads to the kinds of disturbances that the patients experience.
Here at Hopkins, it just seems like that you don't have those barriers and borders that you do at other places, where people, not even just within the department, talk to each other, but across departments, across disciplines, which I think really makes it very unique and not like any place else in the country.
We can make an impact here because of the collegiality and level of enthusiasm, not only within our own department, but with collaborations across the School of Medicine.
One of the greatest things about Hopkins is that we're doing so much awesome research. And that was one of the big reasons I decided to come here, because I wanted to be somewhere where we're still looking into all that.
I'm very, very proud of the fact that Johns Hopkins has become the #1 psychiatry department in America in the most recent U.S. News and World Report. I think that #1 ranking speaks to something very, very fundamental, and that is that Paul McHugh and Ray DiPaolo have conceptualized the field of psychiatry and formulated an approach to the field that really is the best conceptualization, the best approach that there is to be found anywhere in the country.
Some of our most exciting and novel work has come directly out of philanthropic gifts We have been able to do things that we would not have even been able to imagine, in part because we've had the kind of money that comes from philanthropy that's not targeted at something that's already established.
It allows me to ask more creative questions. We have, greater visions that we would like to pursue outside of just our basic federal funding. And it really, I think, helps to move the science forward.
Philanthropy isn't only about money, it's about people. The individual philanthropist very often develops personal connections with the recipient. Many of the faculty at Hopkins have close links, close personal friendships with those who have supported them. And that kind of relationship is inspirational.
I'm forever grateful, and I'd like to now help other people be able to be helped, and other children particularly that have similar problems. I'd like to be helpful to them.
One of the biggest challenges in psychiatry in our department is how we can deliver our big discovery to all over the world.
And I think that the Department of Psychiatry, especially here at Johns Hopkins, offers a tremendous opportunity for all of us to really make a mark in the history of medicine.
The future is truly exciting for psychiatry. We have the technology, we have the molecular developments and genetic developments that are on the horizon.
We are about trying to understand the basis for the things that have gone wrong in mental life, whether their origins are in the brain per se, or in the culture, or in some interaction between the two. Over the next 100 years, that's where psychiatry, like every other discipline in medicine, needs to go. But it's not a simple process, but it's neat, and it's why we're here.